Hi, I'm Buddy Creech. I'm a pediatric infectious disease specialist at Vanderbilt University Medical Center in Nashville, Tennessee. And this weekend, we've been in New York at the IDC New York Symposium, thinking about a lot of things that impact how we care for children in both the outpatient setting and even in the inpatient setting, and what we can do as pediatricians to make sure that our kids are as healthy as they possibly can be. I had a few talks that dealt with things from influenza to bone and joint infections to pneumonia. And to hit those highlights very briefly, we're really excited about the developments in influenza vaccine right now. We talked a little bit about the impact of this universal flu vaccine initiative that the NIH and others are embarking on, and how we might see the reality of a universal flu vaccine in the next decade or two. What would a universal flu vaccine look like? Well, it might be one that we would only give every 3 to 5 years. It would be one that would cover all the circulating strains of flu and maybe even those strains that are potentially going to emerge, particularly in China or in other parts of the world that could affect us here. And we talked a little bit about how important it is to get annual influenza vaccine, even if that vaccine has numbers that range from 30 to 50% effective, because we know flu vaccine is highly effective at preventing death and severe influenza, even if it doesn't always prevent a trip to the doctor every single year. We also talked about pneumonia as we think about things that influenza can sometimes set us up for. We talked about the importance of amoxicillin as the first-line therapy for bacterial pneumonia in children, and the fact that we desperately need better diagnostics to be able to tell if a child has a virus or a bacterial cause of their pneumonia. We think viruses are really common, but it's really hard to know that for sure right now. We also talked about some ongoing studies that may allow us to shorten the length of therapy for pneumonia to 5 days rather than 10. The jury's still out on that one. And then finally, we talked about bone and joint infections. We talked about how hard it is when a child comes in limping to figure out if they just have a viral infection that's causing inflammation of a joint, or maybe they have an infection of that joint. And we talked about the importance of getting a fever history. If they've had fever, if they have a high white count, and if they have evidence of inflammation and don't want to bear weight, those are children that usually need more of an evaluation than those who just have hip pain and maybe lack fever or lack that evidence of inflammation in the bloodstream. We also talked about how we might treat osteomyelitis after diagnosing it, and that oral therapy is just as good as IV therapy and is certainly safer. So we hope that if you weren't able to join us this year, that next year you'll put this on your calendar. It's a great meeting, and it's one that we hope to see you at.